this child is just going to a few details about this baby. This baby is a 4-month-old baby, about 5 kgs, with a complex heart condition called complete aortic canal defect. And this actually is a child with 2 big holes in the heart and 2 valves that were leaky. They were incompetent. And because of that, there was a lot of blood flow into the lungs. And ideally, these children should be operated by 4 months of age.
Basically, this child is from Nigeria. It has got a complex heart condition. As Neil explained to you, it's more than complex, I would say. Any center in the world, the first thing asked for a center is what are your complete aortic canal results are. Based on that, they take a decision about whether the center is good or not. So it's a very complex condition, and it's a condition where the surgeons really struggle to give good results in. And this child came presented to us at Jamshedpur where we started the hospital, and it's excellent teamwork brought this child to the situation. Now is going to go home on Friday.
They brought this child to us on the ventilator, who's dependent on so many supports. We had to wean it all off one by one and give the child back to the parents. And this was a little challenging because the child also had Down syndrome with floppy airways. But eventually what we thought would be a nightmare and would be really difficult went off fairly smoothly. And when we were talking to the mom after the surgery, she had gone through the tension of the whole surgery and the post-op, and she just went to pieces in the end. And she said, you know, my husband's scared of flying, and we would have lost his child if I hadn't come alone. I had left 2 other little babies with my husband to look after, and I flew all the way across 18 hours across the oceans to come here, and I'm so proud and so thrilled and so happy to be going back to Nigeria with a child who's well. And she couldn't thank, and with her we echo our gratitude to the management, to our chairman, to the MD, to Dr. Bauma, to our entire beautiful, fantastic, challenging team for having pulled off this remarkable feat. Thank you very much.
This surgery like this, I don't know if you all understood how complex this was. They had the valves leaking, the heart valves were deficient, and there was only one outlet. Normally we have what we call the right side, the left side. Right side is a good blood, left side is a bad blood, which takes pulmonary artery, which takes to the lungs, get cleaned up, comes to the heart and pumped through the aorta. Here it was a single pipe. Single pipe, and the blood is mixed, the good and bad mix. So there is a lot of strain. So what is clean goes back again to the lungs, so there is a more load. Such a severe condition, as Dr. Neville said, that was the right stage to treat. If it's beyond that, they will develop what we call pulmonary hypertension and become inoperable, and probably won't even last with severe infections. So they came at the right time. We are very happy for the mother. I could see the smile in the mother, and seeing that child going back home, I think is a great gift from all of us. I always told our Prime Ministers, we will get a permanent seat in the UN when we treat people like this, when they go back and tell in their countries what India can give in healthcare for people from different parts of the world. So I'm happy that we are not only able to treat patients of this with major problems like what we have been doing, but if we can treat these major problems for people from across the world, I think that gives credibility not to me, not to Apollo, but to the nation itself. This is what India is capable of. This is what Indian doctors are capable of. We all knew before Apollo started, everybody knew Indian doctors are par excellence. In UK, the entire NHS was run by Indians and Pakistanis, but the super doctors in US. But now back home, we are the best possible doctors breed, which are now given the infrastructure are saying that we can do what other people in the world cannot even do. Do you believe that? Yes. This is what we will demonstrate to the world. So I'm very grateful to the media. I have mentioned this at every press conference across the world of what Madras media has done in propagating the organ donation. I hope this will continue so that we will keep up this leadership and give lot of hope for a lot of people who have no other hope. For a person with end-stage heart failure, if he doesn't get a heart transplant, he lives another few days or few weeks. For the liver, for them that's the end of all. For kidney, of course, they can carry on with dialysis. How many people can carry on the cost of it, and then they can't lead ordinary life? So thank you for all of this, and I'm again, on all our behalf, from all our hearts, we say hearty congratulations, great job. Sindhuri, I hope you will lead a great team so that we will establish several beautiful pediatric hospitals. Thank you.
I called my husband, called everybody back home. I said they should start fasting and praying, that the doctors will be surprised. And when they did it the following Monday, God surprised them. They got the 100% that they wanted. Then the surgery, it was God that did it. It wasn't even the doctors, but it was just God Almighty that did it, because they were all talking, they were just saying it's a complex issue, but I heard unto God that He that have been doing it even in the past for others, He will do it for me, and He did it. So I'm so grateful to Him, and I'm very grateful to the doctors. Where are they? He has a way of making me to laugh. So I'm grateful to God, and I thank the government of India for making it possible to have this kind of hospital here. It's a great thing. And please, sir, I have a favor to ask of you. We need Apollo Hospital in Nigeria. I pray that God will continue to bless you, bless Apollo Hospital, and bless the Republic of India. Thank you so much.